Good afternoon, everyone, and welcome to this third annual celebration of the Merkin Prize in Biomedical Technology. This prize celebrates the scientists that have made groundbreaking discoveries that have gone all the way to impact patients.
What I want to talk about is what I learned from the laureates. I said, what motivates you? What kept you going? And what they said was, they look for the possibles in the impossibles.
You've heard that this prize is for technology. Yes, and that's not characteristic of prizes in general. Most prizes are given for discoveries, finding something new as opposed to inventing a process that becomes useful.
Dr. June, Dr. Levine, Dr. Riviere, and Dr. Sadelain. It's just such an honor to know you, to work with you, to have learned and trained with you.
I was at that point diagnosed with acute lymphoblastic leukemia. My options moving forward were very limited. I may be eligible for a trial procedure called CAR T-cell therapy. The speed of these cells is amazing. Within a week, I was finally on my way home after almost 2 months in the hospital. But I'm happy to report I'm disease-free today.
I just want to highlight what these CAR T cells and living drugs perhaps represent. Not just, first and foremost, the hope that they give to patients with refractory B-cell malignancies, but these were the first cell therapies to have convinced the pharmaceutical industry to produce a cell.
You start with a concept. That is a hypothesis. Then you get to the design of the experiments. There needs to be engineering and scale up and validation before you get to the product.
In the first 5 patients that we treated, we're able to demonstrate that complete eradication of the tumors in the bone marrow of these patients. This really became the eureka moment.
We then moved into the period of serendipity and acceleration, Emily on Infusion Day. Several months later, front page of the New York Times, and Carrie and Tom could have gone home and lived their lives happily, but they started the Emily Whitehead Foundation, so that is the connection that we have with patients.
Somebody gave me an article while Tom was going through CAR T about your daughter, and it was the most inspiring thing to know that there was a light at the end of the tunnel.
The journey of CAR T is a story of persistence, of radical collaboration, and most importantly, of the profound courage of the patients who enroll in our trials.
What are the challenges here that you guys are all thinking about?
So we have a very powerful technology in solid tumors. It's still awaiting the identification of suitable targets in solid cancers.
We are working tirelessly to make CAR T therapy effective against solid tumors, the cancers of lung, colon, and brain, pancreas, that claim so many lives.
I think there might be some other types of cells that can be exploited for this application.
As they say in real estate, in solid tumors, it's location, location, location. Infusing the T cells directly into the tumor, into the brain, makes a difference.
The impact that CAR T cells have had on patients already, that's undeniable and really remarkable. We saw evidence of that today. I think what's going to be the even greater impact is the amount of innovation that it has stimulated.
This is an incredible celebration of science. First of all, I think the Merkin Prize in Biomedical Technology is unique because it recognizes the key importance of technology. We all know a lot about discovery. Medicine is a lot about discovery, but if you don't have technology, you can't get it to the patients. You can't get it to have an impact. And Dick had that vision.
It's opportunities and awards like this that are absolutely catalytic.
This symposium was a wonderful demonstration of teamwork, of the synergy of bringing together different technologies and scientific disciplines.
The grit and the perseverance and innovation and creativity of all the members who have been awarded the prize has played a role in developing these new cell therapies.
It's inspiring, it's heart-lifting. I was on the brink of tears when I listened to the patient.
I thought the symposium was just absolutely remarkable. The ability to bring the greatest scientists across the community to hear about patients and the impact that that science is having on their lives.
The cure is within us. Our own biology holds the key to health and healing in ways that we are just beginning to comprehend.
I think it's remarkable that the inspiration that this gives to young people to develop new ways to fight cancer.
Our lab does a lot of work on understanding how T cells interact with tumors and how we can engineer that for therapy. And so this is I think just a very, very transformative award, very apt project. Couldn't miss it, yeah.
Today we celebrate this year's Merkin Prize laureates whose pioneering work in CAR T therapy has given tens of thousands of patients the gift of durable remission and, of course, the gift of hope. This remarkable achievement is exactly the kind of transformative science that Dr. Merkin envisioned when he created this prize. So first, let us raise a glass to Dr. Merkin. And second, please join me in toasting our 2025 Merkin Prize laureates, Carl, Bruce, Isabel, and Michelle. Their work exemplifies the very best of collaborative science. So to Dr. Merkin, to our laureates, cheers.
They cherished ideas, but they worshiped execution. And I think that's so very important. So that makes me very proud.